Good day to all. Welcome to our class in Community Health, Clinical Practicum, Community Health Management. Please bear with the tone of my voice because I am not currently feeling well while I'm recording this presentation. Okay, so for today, our topic is all about the writing a community health action plan. So, this is the continuation of your previous activity in CPCHM. So, you are done already with the preliminary steps in coming up with an community-based health assessment, as well as the different forms of analyzing the possible sources of the problems in the community. And the next action now that we need to do is to write a community health action plan. So after conducting a community health needs assessment survey or assessment study, the next step is to write a community health action plan or CHAP or CHAP. So this is to address the local health priorities that were identified in your community health needs assessment. So take note, that's the beauty of coming up with a localized health assessment in a community because you were able really to identify the root cause or the real problem or the palpable problem and concerns as well as issues in your respective community. The Community Health Action Plan developed at the end of the Community Health Needs Assessment process can take what was learned through the community assessment process and turn into a written health improvement plan for the community. So as I have mentioned during our first few meeting as well as during our orientation, that you can adopt already your CDX or your community diagnosis for those students who have undergone their primary health care last year, CP primary health care last year, you are done already with your community diagnosis. That's why you have now the basis in your community health needs assessment study or needs assessment survey to focus on. Okay, so that's the as I said, no, as I said rather, that's the beauty of conducting a community diagnosis or having your community health needs assessment because you were able to identify already the possible health problems. Okay, so after identifying already the possible health problems, your next step now is to conduct or to write up your action plan or come up with a health improvement plan or your community health action plan. So what is a community health action plan? A community health action plan is a written document that lists the plans for achieving health improvements in the community. That's why the focus of your community health needs assessment should be the health problems in the community because the focus also of your health action plan is to improve the health of your community. So this is developed in response to the needs and gaps identified from the data collection or in your community health needs assessment. So the plan is written by the Community Health Coalition or community health officers or organization and typically includes establishing and clarifying the desired outcomes, the goals, objectives, activities, assignments, and deadlines for coalition members supporting the action plan. A community health action plan offers built-in deliverables and focuses on doing work in the community to support the priority health needs. So these are the potential benefits of having an action plan. Number one, credibility of the organization. So this promotes, no, having an action plan proves that you are credible individuals or that you are credible future health workers or health workers because you have a concrete action plan to address specific health concerns in the community. Number two, prevent or prevents the occurrence of overlooking into the details. Having a good action plan or having a concrete action plan would prevent the occurrences of overlooking into the details. So what do we mean by this? When saying overlooking into the details, these are the small problems or even major issues or concerns that might arise in the future. But having an action plan, you should be able already to address and foresee, okay? You should have a good foresight, no? Foresee what are the possible occurring problems in the future, okay? Number three, understand what is and isn't possible for the organization. Because in laying down your action plan, you will be having or you need to have your objectives, and objectives should be smart. Okay, one element of that smart is the it's letter A rather, which means the attainability of an objective. Okay, so you need also to determine if your action is attainable or not attainable by the organization. Number four, helps the community to be more efficient by saving time, energy, and resources. Because in your action plan, you need to follow, no? We have these specific steps or your strategies in your action plan. And following your action plan, following your initial plan or your attack and how to implement such health programs would then conserve a majority of our resources. Or in other words, our resources will be focusing on specific action that we need to do. And the last, it increases participation and promotes accountability. Why? Because ideally, in the action plan, this should be made with the people or made with the community people. If you still remember our topics in community organizing and participatory action research, one of the component there is the partnership with the people. Okay, that's why in coming up your action plan, you should do it with the people. That's the ideal setup. Since we are on a distance education, it's not possible for us to actually visit our community. That's why in your action plan, it would just be okay if you come up with your own or your individual or if you do alone, no, your action plan. These are the different terminologies that we need to remember in writing down our action plan. Number one is vision. So what is vision? It is where the coalition or organization is headed, what is trying to do, and what is important and why. So in short, your vision is the future direction of the action plan or the future direction of the organization. Next is the mission. Mission are the principles and purpose determines the focus and sets the direction. Next is goals. So goals is what is expected to be achieved in a long run. So take note, goals are your long-term objectives. Whereas your objectives, these are the more specific steps or the process steps to meet the certain goal and how the coalition action or the coalition rather plans to achieve them. We also have your activities. Activities are the work of the community coalition, or these are the specific activities or actions that we need to do in order to attain our goals as well as our objective. Next is the outcomes, or are the outcomes rather. When we say outcomes, these are the desired effect on the community. So what measures of success would be the outcomes? We also have your short-term, long-term, and your intermediate objectives. So the difference between these three types of objectives is basically their years, no, of achieving an outcome. Like for example, for a short-term objective, generally expected immediately and occur soon after the program is implemented. So you would expect already the outcomes of your program within 1 to 3 years. So those are your for your short-term objective. How about for your intermediate objective? So the results from and follow short-term outcomes usually within 3 to 5 years. And for the long-term objective is the state of ultimate expected impact of a program for about 5 to 10 years. The most critical in coming up in an action plan are the planning steps or how to make your plan. So the plan is to be shared with the community coalition members and partners once the community health needs assessment phase has been completed. So yun nga yung sinabi ko noon that the ideal setup of your community health action plan should be shared. No? The planning should be shared with the people in order for you to increase their participation or to solicit their participation. So that is the ideal. Okay. So in planning steps, you should identify already the things that are necessary to carry out the goals and objectives determined by the coalition. And you need also to break the steps into the more defined steps, more specific steps, and develop a plan that will be more manageable. So the community health action plan should be complete, should be clear, and should be current. When say current, it should address already or it should be able to address the present problem identified based in your assessment. So these are the specific steps in planning or in coming up with your community health action plan. So number one is to review and analyze the results of community assessment. Take note that the basis of our community health action plan would still be our assessment. Number two, choose a group of people to work together on developing the action plan. Okay, so paulit-ulit kong sinasabi to that is the ideal setup. But since we could not provide you the ideal setup, at least we have the idea in mind as well as experience in coming up with a community health action plan. Number three, identify outcomes that would address the issues. Okay, so outcomes are focused at producing a healthy change in the community. So that would be the generic outcomes. Okay, although you could modify it, but since our focus more is on health, that's why the outcome rather is on health improvement or health change. Another is goal setting. So take note, you should be able to determine if your goal is a short term, long term, or intermediate. And we should also decide the activities that supports the objectives, identify what sectors of community will be affected, establish lead responsibility and planning team participants for each goal, and we should keep in mind that our goals and objectives should be smart, should be specific, measurable, attainable, realistic, and time-bound. Number four, identify challenges, obstacles, or potential barriers to successfully implementing interventions. So as I mentioned a while ago, that one of the benefit of coming up to your action plan is to prevent the occurrences of possible problems in the future. So having a good action plan, you should be able already to have a good foresight of what problems might arise in the near future. Okay, so in your plan, you should identify your challenges and obstacles that might hinder in the implementation or might hinder in the attainment of your outcomes. Number five, identify necessary resources and where you will obtain them. Importante din to, no? Ang mga resources natin. Like for example, if you want to conduct a health education, so what are your resources? Do you need printed materials? Do you need expert individuals? Okay? Or do you need monetary resources, financial resources? So those are the things that you need also to identify. Number six, choose individuals and community partners who will support, identify with, and implement the goals and objectives. Number seven, consider the timeline for conducting the activities. Okay, so having a timeline will be used as our basis in the implementation of an action plan. Number eight, include monitoring and evaluation activities in order for us to determine if the program or the activities that we are able to implement are um, or would be able rather to achieve our goals or objectives. And the last is to review the completed action plan. So after writing down all the elements and of course completing the parts of your action plan, you need to review your completed action plan, okay, before the final submission. Okay, so this is a sample community health action plan template. So what are the parts? Number one, We have here, no, the title of your community health action plan, like for example, physical fitness program, the year where you want to implement, when you want to implement these programs. So current year, 2022. And of course, our sector is community health. Next, you have also here your goal. You need to specify here your goals, no? Your general objectives. Okay? So we also have here your lead responsibility. So since kayo na ang magiging lead responsibility of your health action plan, you need to write down here your name. You also need to write down here your justification why physical fitness program ang magiging action plan niyo or kung bakit anong health program man ang gusto yung gawan ng action plan. So in your justification, briefly state the problem identified in your assessment. Take note, you need again to review back your assessment because that will be the basis in coming up with your community health action plan. So like for example, yung justification dito is 70% of the respondents lacks physical activity and verbalize and need to address their health concern. Okay, so take note in your justification, wag lang kayo basta-basta maglagay na lang dyan ng justification without reviewing back your community health needs assessment survey and other preliminary activities in this course. Okay, so I will be revisiting and reviewing and validating kung appropriate nga ba ang community health action plan na ginawa ninyo based from your findings. Next is your barriers. So you need to identify or write down your barriers. Okay, you need to write down as many as you can. That would depend on your personal observation in your community. Like for example, kapag physical fitness program, one of the barrier would be a fitness instructor. One of the barrier would be a nutrition experts. Okay, so you need to write down those barriers. After writing down the barriers, you need to write down also your resources and your source of justification. So the source of your justification is your community health needs assessment or your community diagnosis, or kung nag-conduct kayo ng separate survey, you need to also to write down your survey or your interview. Okay. So next is your on the first column rather, we have here your short-term, long-term, or your intermediate objective. Second column, we have here your objectives. Third, activity. Fourth, persons responsible or partner agencies responsible. Next, we have your timeline column, the costs, and others. Okay? So, first, you need to write down your objective. Okay? So, take note, your objectives should be smart. Like, for example, increase the coordination of efforts to establish, or to establish rather, a fitness area in the community. Okay? So you need also to identify if this short term if this objective is short term, long term, or intermediate. Since establishing coordination would not took years, no, months lang to. That's why we will be writing here letter S, which means that this objective is a short term. So what are your specific activity to attain this objective? So first, you need to conduct a survey or solicit community members for a support. So who will implement this survey or who will implement soliciting community member support? Of course, it will be the community health team and the community officials. So yung timeline natin, yung projected timeline natin, ilang months ba or ilang days or ilang weeks, yun yung ilalagay natin. Yung cost, ilan ba yung possible na magagastos for this activity. But if you want also to add some details, you could add more details here in the others column. Okay. So next, identify funding prospects or sources of fitness facility. Okay, so yun yung magiging second objective natin. Again, you classify it as a short term. So what are your specific activity? Pwedeng consultation and meeting with stakeholders and possible support groups and meeting with a Zumba club instructor or Zumba club or Zumba organization. So persons responsible in this activity, it's your community health team, ilang months ulit, or paano ulit yung timeline, paano yung cost. So, depende na yun sa atin kung sa tingin ba natin ay merong magagastos in those activities. Okay? And please do not forget also to write down here your desired outcome. So, of course, the desired outcome in this physical fitness program is to improve the community's physical activity and lifestyle and increase the adults' engagement to physical activity. Okay, so again, take note that the focus rather of your desired outcome is on the health improvement of the community. Okay, so again, that's the end of my presentation. So please review back and revisit your previous output and re-identify if you are not sure with your identified health assessment, okay, or identified problems rather based on your health assessment. You could re-identify and resubmit your output and come up already with your action plan. So, ano magiging output natin for this activity ay ganito po. Ito pong buong community health action plan natin na ito. Okay? Since you are now having your a 1 week health break, okay? My apologies for uploading this instructional video late, no? Because I am I am actually on home quarantine at ngayon lang medyo naging okay yung aking boses. Okay, so please keep safe and you could just start doing this after your health break and you may now enjoy your health break. Again, thank you very much for your time at mag-ingat po tayo lahat.